virtual media briefing. So the intention for this afternoon is to provide an update of the fund's activities over the past, approximately the past 6 weeks, basically since the formation of the fund. And the idea is that as the country moves into the risk-adjusted phases of the lockdown, clearly our state of readiness becomes crucial. So what we're hoping this afternoon is to demonstrate how the Solidarity Fund has used the 6 weeks and the funds from donors to contribute to the country's state of readiness, and also to provide relief and assistance on the humanitarian front. The two speakers for this morning will be the chairman of the fund, Gloria Sirobe, the CEO of the fund, Nomkita Nkweni, but also for the Q&A session, we will have available the various leads of the fund's activities, Dr. Johnny Bloomberg, Paul Bondi, Nicola Golombik, John Hunt, and Tandeka Ngube. So on that score, I'm going to hand over to the chairman of the fund, Gloria Sirobe, to begin the briefing properly. Thank you, everybody. Andy, if we can unmute Gloria, thank you.
Okay. Good morning, and thank you for joining us on our first Zoom update. As we experiment with these new ways of talking and interacting with each other, I was reminded this week of the power of human connection and what can be achieved if we work together against a common threat in our country. We have seen from around the world how critical regular and widespread testing is to slow the spread of the coronavirus and to support a successful easing of lockdown. But many South Africans in outlying areas find it difficult to access basic health care, let alone COVID-19 testing. And so this week, working together with the Transnet Foundation and National Health Laboratory Service, the Solidarity Fund helped coordinate the conversion of 2 of the foundation's healthcare trains into mobile testing clinics that can take COVID-19 testing to outlying areas in KwaZulu-Natal and the Eastern Cape via our railway system. This initiative will not only help prevent the spread of the virus, but it will gather and collate important information and data to feed back to the National Command Center set up to deal with the pandemic. As the Solidarity Fund, we are particularly grateful for the spirit and the care in which this partnership with Transnet was formed to make it work for these 2 provinces. Since 1994, Hello Pepper 1 and 2 have provided basic medical help and healthcare education to vulnerable communities across the country. Each train has a permanent staff of 22 healthcare professionals, including nurses and healthcare educators. The Solidarity Fund has also approved funding for 400,000 COVID-19 testing kits, costing 250 million rands, to support increased testing for the deadly virus across the country. So this critical testing intervention comes at a time when we need it most. It will go a long way in mitigating the development fault lines exposed by the COVID-19, and it will help the provinces ramp up their massive screening and testing programs, especially in the rural parts of the provinces. We also salute our medical professionals for the work and dedication that they do in protecting all South Africans from the threat of the coronavirus. This partnership is unity in action, with the Solidarity Fund playing a coordinating role with multiple stakeholders and making real interventions to support government efforts to prevent the spread of COVID-19. We welcome it as a catalyst in the difficult war we are waging against this invisible enemy that has stabilized the whole world. Of course, interventions such as these are made possible with the generous contributions of all our donors, individuals, companies, and foundations. On behalf of the Solidarity Fund, I do wish to express our sincere gratitude for your continued country's medical and humanitarian efforts in our fight against COVID-19. The fund is independent of government and has a board whose mission is to ensure that the funds donated by South Africans of all persuasions are used effectively and responsibly in the fight against COVID-19. We work with the government's National Command Center and Business for South Africa to help the country manage the threat of COVID-19. All of us are running this marathon together, and at times, it will feel as if the race is unbearably long. As the President and our scientists often remind us, the real fight is ahead of us. We must all prepare ourselves for one of the most challenging periods, not only for our young democracy, but of this land's history. I believe that we have lived up to your faith in us and used the resources we have been given most effectively in our short space of time. I would like now to hand over to Nomkita, who will provide an update on our various critical interventions as a CEO. Thank you very much.
Thank you very much, Gloria, and good afternoon, colleagues. Good afternoon, everybody. Gloria spoke about embracing technology, and as I tried to do that to ensure the appropriate branding, obviously because this is a Solidarity Fund briefing, I think it's a generational thing, because when I tried to do that with my screen, it ends up looking like this. So there must be a generational issue in terms of technology, but nonetheless, I think welcome, and once again, thank you for making the time for these briefings, which are part of the commitment that we have to ensure transparency and provide feedback on the work that we are doing on behalf of all fellow South Africans who have continued to generously pull together their efforts towards strengthening our country's resilience against the effects of COVID-19 through supporting the Solidarity Fund vehicle. We will continue to uphold this principle of continuous feedback as we navigate our efforts through the changing phases of this pandemic and the context of our own relative resources juxtaposed against the greater need. As a continuation from our last discussion, today I hope to be able to leave you with 3 key takeaways. The first one is that in the 6 weeks since the establishment of the fund, we have built an institution with capabilities, competencies, and networks that support the country's overall effort against COVID-19. Secondly, with the time and resources available to the fund, we have played an important and tactical role in supporting our national health system to get ready for the expected surge in coronavirus infections and to aid in slowing its spread. Finally, by playing a role in the emerging food security crisis, we have built a network of relationships that is committed to innovation and partnering for more sustainable humanitarian solutions. Now, let's start with an update on the institution itself and where we are with our funding. The Solidarity Fund is now a fully fledged operation. We have in place a credible board and subcommittees who meet on a weekly basis. In fact, last night, our board meeting finished at 10:15, so people are hard at work. And these board members work alongside fund administrators as well as external and internal auditors. We also have more than 90 full-time voluntary staff across a network of 21 companies and organizations that are providing supporting services. In the spirit of unity in action, all of these talents and skills that have been mobilized to assist the fund are doing so on a pro bono basis. So no one earns any fees or salaries from the Solidarity Fund. The spirit of unity has seen the fund receive 2.7 billion in commitments, with 2.16 billion already received from more than 175,000 South Africans in their individual capacities and more than 1,500 corporates and foundations. South Africans donating a proportion of their salaries through what we call salary sacrifice have thus far generated 22 million in contributions, which is an incredible demonstration of generosity towards their fellow compatriots. We would like to believe that by setting up the necessary institutional and governance frameworks, we are able to demonstrate the rigor and professionalism in how the contributions to the fund are being deployed. The Solidarity Fund has played an important role in ensuring that our country is now in a much better position to deal with the effects of the virus than when the president announced the lockdown and the establishment of the fund just a mere 6 weeks ago. This is across our focus areas of health response, humanitarian relief, and creating awareness and behavior change through the Solidarity Fund campaign. I'd now like to take you through our progress on the health interventions over the past 6 weeks. When the Solidarity Fund was formed in late March, South Africa faced a critical shortage of personal protective equipment, which we knew our frontline healthcare workers would need. We had seen how in other countries, a shortage of PPE meant unprotected healthcare and frontline workers who paid a heavy price in terms of both illness and death. And so immediate action was galvanized towards this effort. To put things in context, before the lockdown, 92% of all the medical equipment we use in South Africa was sourced from international markets, and only 8% locally produced. As we entered the lockdown period, there was hardly any PPE available in South Africa because of supply chain constraints, and this meant that we had to put in place a rapid response to secure the necessary stock. Within 7 days, the fund had approved 100 million of funding to procure PPE and made arrangements with the then newly formed Business for South Africa's procurement team to begin the process of placing orders. Within a month of the formation of the fund, we had approved a total of 905 million towards the procurement of PPE. The result of this early response is that nearly 80% of the surgical masks and 100% of the N95 masks that are required to meet the weekly demand for healthcare workers, at least until the end of June, was secured. This should be seen relative to the size of the fund and in the context of our efforts to augment the broader work that is done by the National Department of Health. The PPE consignments arrive in phases, in line with lead times. And as they arrive, it's distributed to various provinces or directly to hospitals and clinics. As we speak, we are expecting today the arrival of the critical mass of PPE that was ordered, and this will continue to be distributed in line with the Department of Health's needs and priorities. Furthermore, outside of the hospital networks, the PPE has also been procured to support the work of community-based healthcare workers. Now, this massive procurement exercise to ensure that essential medical supplies of the right quality were sourced, ordered, and distributed in a very short time frame was not without its challenges. Firstly, the global supply and procurement of PPE has been extraordinarily difficult, with almost every country in the world, not to mention businesses and citizens, trying to buy very, very limited stock. Prices moved daily, sometimes even hourly, as suppliers struggled to meet the almost insatiable global demand. This initial emergency phase of procurement, given the limited local manufacturing capacity, meant that much of the stock in this early phase was procured globally. Procurement decisions were always guided by the key imperatives of price, quality, and most importantly, speed of delivery. It is important to note that in this initial emergency phase, there had not been enough local manufacturing capacity to meet the demand. And it is pleasing to see that we now see more Black-owned businesses and the activation of local manufacturing starting to come strongly to the fore. The efforts of organizations such as Naspers Group, the likes of the Motsepe Foundation and other foundations, which have donated to the Solidarity Fund, but also procured supplies directly, they shared similar experiences and have assisted greatly. This means that nurses and doctors in hospitals, clinics, as well as those in the field, doing mass testing or working in NGOs supporting the health system, will have access to the critical PPE they need. Following this first emergency phase of procurement, we now have the systems and processes in place to procure more critical PPE and equipment from local manufacturers as they can produce in line with WHO standards. And we have more than 6,000 suppliers that have been registered on the Business for South Africa's database and platform. We are also pleased to see the innovation that is taking place. And just this past week, we approved the funding of 11.3 million to support the local manufacturing of 2 prototypes of non-invasive ventilators. This initiative is led by the Department of Trade and Industry and managed by the South African Radio Astronomy Observatory, and the project aims to manufacture 10,000 of these ventilators by July, when the prototypes pass their various phases. And this is a critical time because this time will be coinciding with the expected peak in what we envisage as being coronavirus infections. So this is an important investment. In addition, we have committed 250 million rand to the National Health Laboratory Services to double their order of test kits, enabling them to undertake the mass testing the country so desperately requires to track the pandemic. And of course, we are partnering with them in ensuring testing reaches the rural areas, as Gloria has just outlined in our partnership with Transnet and the Pelopepper trains. Now, during the period of lockdown, we saw an emerging humanitarian crisis unfolding with regards to food security. At our last press briefing, we outlined our target of providing food support to 250,000 vulnerable families during the lockdown period. I'm pleased to say today that we have not only met this target, we have gone even further. As part of this comprehensive food relief effort, the fund has supported 300,000 families across 9 provinces, both in urban and rural areas. This was achieved without increasing the 120 million we had allocated to this intervention, meaning that we were able to increase the impact through improved efficiencies. Feedback from our distribution partners shows that it is the fostering of relationships between communities, NGOs, community-based organizations, faith-based organizations, as well as local authorities that enabled this distribution to happen effectively. This once again lives to our mantra and objective of unity in action. Having reached this first milestone, the Solidarity Fund will now be piloting a number of more sustainable methods of food relief. These include food vouchers and cash systems to reach those households that will fall outside of the social grant net that was announced by the President, or those families who are still going to be experiencing the severe food insecurity as a result of continued economic disruption. Within the humanitarian effort, we are also now starting to expand our interventions beyond food security as we seek to respond to the ancillary challenges that are brought about by this pandemic. So following what we term as being the first emergency phase over the past 6 weeks, we continue to work towards responding to the different phases of this pandemic. From a health perspective, we are entering a period where we believe that more targeted interventions to build testing capacity, as well as tracking and tracing, will be of paramount importance. From a humanitarian relief point of view, we are working with various civil society groups and women's groups to respond to the emerging scourge of gender-based violence, and we will update you on the specific interventions at our next briefing. As we have seen with the easing of the lockdown, educational messages creating awareness on the importance of wearing masks, testing, and social distancing as people gradually go back to their daily activities, they will require increased attention and investment. In conclusion, whilst we give feedback about numbers, facts, and figures, I think it's important to note that behind every stat quoted is a real person. For many families, food support has provided a lifeline. It seems incredible to me that this has been made possible by the generous contribution of a stranger that they will likely never meet. Perhaps it was somebody swiping their credit card at a supermarket and donating a small amount on their grocery bill, or a salaried worker who has chosen to donate a third of their monthly income to the Solidarity Fund at this difficult time. This generosity has mattered to those families, and on their behalf, we would like to say thank you. Behind each mask that the fund has helped purchase is a parent, is a brother or a sister who's putting their life on the line to take care of fellow South Africans. Each one of our donors and our stakeholders can take comfort in the fact that ultimately their contribution to the Solidarity Fund has helped bolster the resilience of our first line of defense. Coincidentally, this week, the world celebrated International Nurses Day, and would like to salute each and every one of our nurses for their work and dedication, not only on this day, but every day. As our country faces one of its toughest challenges yet, the Solidarity Fund has represented that beacon of hope, where all of us as South Africans have come together to lend a hand towards fighting this common enemy. The fund is a great example of how we can put our differences aside and work together towards our common good. I now thank you for your attention and end my update at this point. We will now move into a Q&A session, which will be facilitated by Itumeleng. And as he introduced earlier, to join us in answering the questions that you might have, our colleagues, Dr. Jonathan Broomberg, who leads our health response, Tande Ganube, who leads our humanitarian effort, alongside with Nicola Gambalik, who took this role and is now focusing on disbursements and execution effort. John Hunt, who is behind the communication and awareness campaign. And last but not least, Paul Bondi, who coordinates our fundraising efforts. So we look forward to interacting with you, and over to you, Itumeleng.
Thanks, Nomkita, and thank you as well, Gloria, for that. Yeah, so Nomkita has told you who's on the panel. Just in terms of how we're going to run the Q&A session, you all have seen on your screens that there is a Q&A function. So if I could encourage you to use that, and then we'll take questions in clusters of 3 or 4. We will also try and take any verbal questions, but if in the first instance we could use that Q&A function. So we have one question at the moment, and it's from Sbu Ngwala. Sbu, I'm not sure where you're from. If I could encourage everybody to just please say, when you're asking your questions, whether it's verbally or whether it's through Q&A, if you just tell us which organization you're from. So the first question is for you, Gloria. And the question is, given the country's inadequate rail network, particularly in the 2 targeted provinces, I'm assuming he's referring to the initiative with Transnet that you announced. But so, given the country's inadequate rail network, particularly in the 2 targeted provinces of KwaZulu-Natal and the Eastern Cape, do you think you need a more targeted intervention for the rural parts of the country? So that's question 1. The second question that we have is from Luyolo, and Luyolo asks, of the 2.16 billion received already, how much has the fund dispersed to COVID-19 programs to date? And he's happy with just a rough estimate. And how much has been spent on local procurement? Luyolo is from Business Day. Those are the 2 questions we have at the moment. And so let's take those 2 questions for now. Gloria, are you happy to take those, or are you happy to distribute them?
I think the second one, Nomkita, prepare for that. The first one about the railway network being inadequate, actually that's not the case. The railway network of is more than adequate in terms of covering the country. What you do have is it not being used completely. So what you find with the Pello Paper Train, which is why it is very important, it goes to where nobody goes. And so it is in Stutterheim, it will be in Idujwa, it will be in Butterworth, then or Cookhouse, those kinds of places, Umtata. There are railway networks right through the country. That is why it's a very popular train. It's the same thing with KwaZulu-Natal. So I do not think, of course, there can always be more interventions, but this is the most aggressive I can see because it is creating testing stations where ordinarily they would not be there. Cook House is a place where it needs a testing station, for example, and there's a railway network there. The railway network, I think it is adequate.
So on the second question, if I may, Itumeleng, I'm not sure if can I go?
Yes, please.
All right. On the second question that relates to, so how much has been disbursed? So of the 2.1 billion, we have disbursed to the tune of 1.2 billion. And remember that 1.2 billion will also include our allocation to the food response, which was 120 million. In terms of the ratio between local, suppliers and so forth, I think we need to come back to you on the exact precise figures. But given the context that I painted earlier, I think it is fair to say that we are only now starting to see the activation of local manufacturing. I mean, just this last week, we actually signed off the procurement of gowns, for reusable gowns for the hospitals to the tune of about 40 million to a local supplier. So I think that it's fair to say that in the initial phase, we did not have a huge manufacturing capacity, and we're starting to see that come to the fore. And so I think we'll be able to provide you with the nitty-gritty of those numbers on local procurement, but I think you can do kind of like a weighted kind of view based on the context that I pointed out earlier.
We don't seem to have any further questions at the moment. Andy, is that right? There aren't any in my Q&A. I don't know if anybody... okay, there's a new question. From Newsroom Africa, Smu Ngalwa asks, you spoke of food vouchers and cash systems. Can you please explain how these will work? So that's... we don't have, I think just go ahead and take that, Nomkhita. We don't have any other questions for now.
All right, and I will in turn ask some of my colleagues to come in here, Nicola and Tandega in particular. So how I will preface that is that one of our key observations, obviously, as a lot of us weighed into the food relief, Solidarity Fund and many, many others, we were quite acutely aware of the potential indignity of how food parcels are being distributed, the lack of choice that families have in terms of being able to make their own choices with how it is that they are able to buy whatever it is that they need. And also in line with the lockdown regulations, we were also quite mindful of the social distancing and the challenges around that as food was being dispersed. And so through the use of innovative payment platforms and voucher systems and partnering with various partners, including the likes of the South African Council of Churches and others, we believe that the use of vouchers is more sustainable. So Nicola, maybe I can ask you to weigh in on exactly how the modalities of these voucher systems will operate.
Thank you, Nomkhita. So as Nomkhita has mentioned, we will be implementing various different forms of voucher and cash transfers that may be scalable nationally, but may be appropriate to different communities and different contexts. We will be doing so, as Nomkhita mentioned, in partnership with faith-based organizations, including the South African Council of Churches and Islamic Relief. And we will be experimenting with different models. These include vouchers that can be redeemed locally through spazas and local retail in communities, in townships and villages. We will be experimenting with vouchers that can be redeemed in larger supermarkets, and also with cash transfers that will be redeemable, and all of which will be available through mobile phones. So the idea is to experiment with lots of different models rather than to have picked one. The different systems work better for people in different parts of the country, depending on what they have access to, the challenges of redeeming and even redeeming cash, redeeming food and redeeming cash, depending on where they are. And so we think that it's a catalytic effort that we're investing in, not just to complete our food response in this period. And I'm glad to say that that we will, through these additional efforts, probably be able to increase the number of households that we reach to closer to 300,000 rather than the 250,000 that we originally promised. But with the same funding envelope, owing to some of the efficiencies we've been able to gain in the process. And through these voucher and cash transfer pilots, we'll be able to provide, I think, the country with models and support the models that are emerging for ongoing support to vulnerable households over the next months of the pandemic, and that may be applicable even beyond the food response, that may be useful for the supply of emergency health supplies or household health or sanitation goods into the future. Thanks.
So at the moment, I thought we had. So if I could just, so we've got a question from Luyolo from Business Day again. If I could please just encourage all of you to just keep sending your questions ahead of time. It'll just kind of make the process more efficient. But let's take the question from Luyolo for now. With regards to the food voucher cash systems, are ward councillors involved in any of this project? Seeing that there have been allegations about ward councillors looting these and distributing them according to party lines. Namkita, do you want to take that? And I don't know if Nicola wants to answer that. Before you answer, again, please, if you can, just please keep sending your questions so that we can line them up and answer them as efficiently as possible. So thanks, Namkita.
Thank you, Itumeleng. So I think Nicola can weigh in here, but certainly as I alluded to in the earlier parts of the briefing, when we were distributing, let's call it, the food parcels to vulnerable families, the approach that was taken was to partner with community-based organizations, faith-based organizations, because they are the ones, who know the people locally. And this also required the coordination with local authorities. As far as the food vouchers are concerned, I think that we still are going to continue to have partnerships with faith-based organizations like the likes of the South African Council of Churches, for example, because they've got an extensive database. But I think Nicola can expand if this leg will include any local authorities per se. I think that it's quite important to also point out that the approach that's been taken is, an approach that seeks to use technology as much as possible. And given that people have got access to mobile phones, to use that as mediums as much as possible. But Nicola, maybe you can expand.
Thanks, Namkita. I mean, I think just to reaffirm that the beneficiary identification process that we implemented for our entire food response has been clear. 58,000 beneficiaries were identified by the Department of Social Development, and all the rest were identified and chosen and delivered to through the NGOs and CBOs and faith-based organizations that the fund contracted with directly. So I think it is very important to state that those organizations were entirely responsible for the beneficiary identification. There were certainly, and there was certainly, as Nomkita says, in the process of distributing actual food parcels, which even as we move forward may remain a feature of South Africa. There are communities that live very far from retail outlets, and with social distancing, there may be a need for those ongoing processes. But and where distribution is involved, there certainly did need to be, as Nomkita said, interaction with local government departments, municipal entities, as well as local SAPs to ensure that distribution could happen without incident and could happen within a legal and managed framework to avoid social distancing and any other risks associated. But that is it was in order to smooth the distribution process and was not involved in any way in beneficiary identification or the selection and distribution itself. Thank you.
Great, thanks. Thanks for that, Nicola. Nomkita, are you happy with that? You want to add to that, or shall we go into the next one?
I think we can move on. She's covered it quite extensively. Thanks, Vitumile.
Okay. We have 2 questions now. Go. Fantastic. 3 questions. Okay, we're starting to get into a rhythm. 2 questions are from Smu Ngalwa. The first question is: you said 1.2 of the 2 billion has been spent so far. What will you be spending the balance on? His second question is on the cash system. How much will go to recipients? In other words, what is the exact amount of these cash payments per recipient? How much have you set aside for this? We also have a question from George Matlala from Sunday World. George's question is just for clarity. Are you saying that Business for South Africa procured the PPEs overseas or used local companies that had to source the PPEs from outside the country? Those are the 3 questions that we have for now. So we take those.
Okay. So on the first question with regards to what will the balance be spent on, I think as I tried to end off before I concluded, I tried to indicate that clearly we are also trying to plan and our actions according to what we see as being the various phases of this pandemic. And so whilst I attributed, that first phase as being the emergency phase that was focused on really shoring up and supporting the front line in terms of healthcare workers, as we move into this next phase now, as we anticipate the easing, as we've already seen from level 5 to level 4, and activities resuming, on the health side, we are really looking to put some resources towards the ability to be able to track and trace, because that would be important. And then, over time, I'm sure we'll also be looking at how we can, with the limited resources we have available, to be able to provide care and support through isolation facilities and so on as we head towards this peak. And that's on the health side. And maybe Jonathan Broomberg, who is our lead and expert on the health side, can expand on this. And then certainly on the humanitarian effort, an immediate area of focus for us is around the GBV violence that we're experiencing, and how we provide places of safety for women and children. And just before this call, we were actually with our technical advisory panel, which includes preeminent persons like the Mark Haywards, the Nolita Fagudes, and so on, who are part of our technical panel, including the head of the UN for Africa, NADOS, and others, who are part of the collective of helping us shape how we ensure that our interventions on the humanitarian side are effective and they are responsive. So that's how we are planning the next wave of allocations. I've already mentioned the research around the local manufacturing of prototypes, which very strongly starts to activate some of the solutions to be coming from us here in South Africa. And so those are the various things that are in our plans at the moment. And maybe, Johnny, before I hand over to you, as you can further expatiate, especially on the health side, and maybe Tandega on the humanitarian side, the question from George, which is clarity, was the PPE source. So I think it's been a combination of both, George. So certainly, I mean, what we've seen is that, firstly, I think it's important to articulate and explain how the process works. So when Business for South Africa was obviously set up, and Business for South Africa was really set up as being the collective efforts of all business formations, traditional business, black business, to come together to really co-create the solutions around how this pandemic could be dealt, but also most importantly, to co-source and crowdfund the resources, skills to be made available. And there are various pieces of work that the Business for South Africa formation does, but in the context of how they interact with the fund, it is through the procurement end-to-end processes that have been built within Business for South Africa that seek to ensure that we can be able to procure, having followed the appropriate processes in terms of supplier vetting, understanding the quality of products that is being offered, and also ensuring that this is being done at scale and at speed, because in that first phase, that was absolutely what was required. So I think it's important to set that context to understand that that is the value chain for Business for South Africa, and the fund effectively outsources, or rather works with Business for South Africa in the full procurement engine. We make the decisions as a fund on how we procure or what it is that we need to procure in line with the guidelines that are provided by the National Department of Health as being the immediate areas of need and demand. And the value chain through a service level agreement with BSA then effectively deals with the end-to-end process. And so having said that context, and I just want to also say then that in terms of the sourcing, I think you will see that there's been a combination. I've attributed to examples of what is happening in terms of local manufacturing, but I think that there have been instances where we've procured directly from global partners, but also where there have been suppliers that are intermediaries that are creating the interlinkages in terms of demand and supply. So it's been across that full spectrum. So Jonathan, I don't know if you want to come in and expatiate on some of the focus areas and anything to add on this last question as well, please.
Thanks, Nomkhita. I can be very brief. I think you've given very good background. I will just make the point that we are now hoping that the provincial procurement mechanisms for PPE are kicking into life, and so the role for the fund in that emergency phase of PPE procurement will diminish quite quickly. As you said, we are then looking to other areas where the funds available from the Solidarity Fund can act quickly and have a catalytic impact in other areas related to the COVID-19 response. As you mentioned, one of these is clearly scaling up the capacity of our laboratories to do far more daily testing for COVID-19. We are currently both across the National Health Laboratory Service and adding in the private laboratories not doing enough testing. There is additional capacity in the country, and part of what the Solidarity Fund is looking at is, can we fund some additional capacity, and can we also assist with the country gaining access to additional reagents, the kits that are required for all of our laboratories to perform the tests. So scaling up testing is a big focus. As you've also mentioned, the whole idea of much more efficient and sophisticated contact tracing, and then isolation of positive contacts and positive cases, and those who've been in touch with them is also critical. And we will certainly look to add some impact and some funding to proposals there if we can see them. Of course, we're also engaging with the provincial health authorities and others about to assess the needs of whether the public hospital system needs further support in terms of ICU capacity, high care capacity, etc. So I'd say those are the major focus areas beyond procurement of PPE, and I'll stop at this point.
Thank you, Itumeleng. There was one other question, and then maybe as Nicola Thandeka, you weigh in on the forward-looking on the respective humanitarian effort that we didn't address from the colleague from Business Day in terms of the amount that's set aside for the vouchers. I think clearly with the previous food relief effort, I think what we had said was around 400 per family. So I think with the vouchers, it's going to be close, but Nicola, you can provide that detail.
Thank you, yes, Nomkita, that's correct. So the vouchers and cash transfers will be 400 Rand per family, and we have set aside a further 13 million in this next immediate phase towards those pilot programs. And that will, in addition to the additional parcels we've been able to do, as I said, take our overall distribution number closer to 300,000 families. Thank you.
Thank you so much. Itumeleng, I don't
Yes.
know if that, Otandega, thank you.
Yes, no, I just wanted to add, thank you, Nomkita. And Itumeleng, the question, Nicola has answered that it's 400, approximately 400 Rand, but we did say we are piloting it. And the reason why the next steps, and we want to provide a mixed bag solution in terms of food and voucher system and cash, because we've also, the problems of South Africa haven't gone away with COVID. They've just been they've just been heightened. One of those is your girl child in terms of sanitary products. So the cash is going to give families to an opportunity to be versatile and buy the need that they're facing at that time. And also around humanitarian, what is important is that as we move through the different levels, Nomkita did allude to it, our response needs to be targeted and relevant for what we're seeing in the country. So we'll always come back, and it's a strategy that's moving as the pandemic itself goes through South Africa.
Thanks, Itumeleng. I think you're on mute, Itumeleng.
Okay, sorry, technology. We're getting close to the end of our briefing, and we have just one more question. So please, if there are questions out there, please let us know. Sbu Galwa asks again, I think you have asked 90% of the questions, Sbu, but the question that you've asked now is, you've said that 905 million has been spent on PPE. Do you have the quantities for the different items that were procured? Also, you said 11.3 million has been set aside for the manufacturing of ventilators. Who are the companies who are working on the prototypes? Nomkita, I suppose you and Johnny will take that.
Thank you for that, and thank you, Sbu, for making this briefing interesting and valuable, because we've been getting a lot of questions from you. Yes, Sbu, in terms of the figures, we do have the amounts with regards to the types of PPE that's been bought. So in excess, I think by the time all of the procurement is delivered, we will have 55 million items of PPE that would have been, or pieces of PPE that would have been procured and landed. Currently, in terms of our purse and what we've disbursed and paid for with orders that are currently in process and also what's landed, I think we are at about 35 million pieces of PPE. And that's broken down smooth, to various items. Things like, your basic surgical masks, KN95 masks that Johnny will be able to explain what the details are, goggles, aprons, gowns, and so forth. So what I would say is that, as I said earlier, in terms of when you look at the categories of, how we filled those buckets, certainly I think that we have subscribed on the masks, and I would also say on the gloves. I think where we are looking to ramp up our efforts in terms of sourcing supply is really around the gowns and boots, and so forth, boot covers and aprons and so forth. We also have 200 ventilators In addition to aside from the ones that we're talking about that are locally manufactured, so we've procured 200 ventilators that are the high-end ICU type ventilators that will also be arriving in a month or so, in addition to things like goggles, shields, and so forth. So I've aggregated the number of pieces in terms of 35 million as to how far we are currently with the production and the spend and the procurement that's happening, with the ultimate intention that we will have procured 55 million pieces across those various buckets of categories. Maybe Jonathan, you can talk about the prototype and the organizations, which are really some of them South African national research organizations, given that this is a partnership with the Department of Trade and Industry and others. So Johnny, maybe let me hand that over to you.
Thank you, Nomkita. Yes, thanks for that question. So this was a process, as Nomkita's described, that was managed by the Department of Trade and Industry and the South African Radio Astronomical Observatory. They reviewed submissions from 95 different companies and then selected 2 consortia. One of those, as Nomkita has indicated, is the CSIR, so a sort of public research organization. And then the other is a consortium of 5 different companies, each of which is playing a different role. These are all South African companies, local manufacturers, some of them playing different roles in providing different parts of the prototype. I do believe we need to get clearance from the proposers, the DTI and the SARAO, before we can actually release the names of those companies. But they are, local engineering firms and manufacturing firms who were selected out of a very large bidding group as having the best solution, quickest turnaround time, and most cost-effective prototypes.
That seems to be, we seem to have reached the end of our questions. We don't have any, yeah, I think we have now exhausted our questions. So thank you for that, Nomkita. I'm going to hand over back to you to end the session.
Well, thank you to Meleng. Thank you to everybody for joining. And as I said in the beginning of the briefing, it's important for us to ensure that we live up to the ability to be transparent and continuously update South Africa, because it is through South Africa's generous contributions that the fund is able to exist. And so we hope that this update has given you some insights into our work 6 weeks in, and we continue to look forward to your support and thank you for the time. Thank you.
Great, thanks. Gloria, any closing words, or shall we close it off?
She's on mute.
Okay, great. Okay, no, and I think she's happy with that. Okay, thank you everybody for attending. We appreciate you making the time. We hope that was useful, and remember that we continue to try to put as much information as possible on the website, information about the funds that are received, the funds that are dispersed, the activities. So please feel free to go onto that website, and if to the extent that you think that that website is missing information, let us know what other kind of information you think would be useful to have on the website. And yeah, no, thanks again for your time, and have a good afternoon.